Okay, so a podiatrist is a foot and ankle specialist. So podiatrist first, we have an undergraduate degree, which is a 4-year degree, usually in biology or biology pre-med, where we take basic biology courses and pre-medical courses. Then we go on to podiatry school, which is a 4-year degree, where we are specialized in the foot and ankle from day one. So we learn the whole human body, but when we get below the waist, we truly specialize in every aspect of the lower extremity. Then from there, most of us do 3-year primary and surgical residency programs all over the country. I completed mine at the Dayton VA, where I learned podiatric primary care as well as surgical care for the foot and ankle. So when you compare a podiatrist to a manicurist or a pedicurist, we are surgically and medically trained on all aspects of the foot and ankle. So when we treat a patient, we not only treat them superficially, but we treat them holistically. So when a diabetic would come to me, I'm looking at the whole person. I'm looking not only at their feet, but I'm looking at their skin. I'm looking at the texture of their skin. I'm looking at their body habitus. I'm smelling, I'm hearing, I'm seeing. Like if I smell cigarette smoke or I smell marijuana smoke, then I know this person is a smoker. So they have additional risk factors on top of just being a diabetic. If I'm looking at their skin and it's dry, it's crusty, as black folks say, it's ashy, or they don't have hair on their legs, then that tells me they may have vascular disease, which is a decrease in blood flow. And then when I look at their nails may be thick and crumbly. That also tells me that they may have diabetes, and it may be uncontrolled, because diabetes decreases your ability to fight off infection. So as a podiatrist, I can walk into the room and determine and then mentally come up with a treatment plan for that patient. So I may say to that patient, you're diabetic, today we're gonna trim your nails, we're gonna get you some diabetic shoes to protect your feet when you're walking around, we're gonna check your vascular status, we're gonna check the blood flow in your legs, make sure you're getting good circulation. Then I probably would order some kind of lotion, because I know that a diabetic may not make as much oil as a non-diabetic. So they need to add the oil to their skin so it doesn't crack or fissure. So a manicurist would probably just go in and scrub their feet, put some lotion on them and trim their nails, but they wouldn't know the medical reason behind the issues. They could just treat them more cosmetically. So when you come to a podiatrist, we're medical professionals. So we can not only diagnose, but we can treat. And what we can't treat, we can refer out to other specialists who can address all their different issues.